Welcome to IdeaGen TV. We are honored, we're thrilled, we're incredibly excited for an incredible exclusive interview today with Carolee Lee, CEO and founder of Wham. Carolee, welcome.
Thank you so much, George, and thank you so much for having me today.
Well, Carolee Lee, you have a beautiful name and you've done incredible work. I'm just so incredibly impressed by what you've accomplished and what you will accomplish, no doubt. Could we start, Carolee, with why did you create Wham and what is its mission?
So Wham basically was created because of a need that I realized existed that hadn't been fulfilled. And it had to do with the fact that I had built a very successful international brand, and women were at the heart of my company, both as my customers and my employees. They were 85% of my workforce. And I was an entrepreneur who started at my kitchen table and grew and built a global brand and eventually successfully sold it. And so I can tell you from firsthand experience that women's health is an issue that we can't afford to ignore. And my role led me to think a lot about the economic impact of women and to see that impact firsthand. And I also saw the ways that health issues could impact women's finances and their careers, and the effect that illness could have on someone, on their family, on their business, and it turns out, on our entire economy. Women are more than 50% of the US population and workforce and control over 60% of personal wealth. And they're also responsible for over 85% of consumer spending in the US, more than $11 trillion, and make over 80% of healthcare decisions. Along with women driving our economy, our data shows that companies where women are well represented at the top outperform their peers, yet women are still vastly underrepresented in the C-suite. For example, this year, a record 44 women are running Fortune 500 businesses. It's certainly progress worth celebrating, but it still means that just 44 out of 500 companies, or 8.8%, are women-led. So I realized that I saw what was happening out in the landscape and in the scientific community in particular, and what is more important than our health. So for example, the OECD's latest report showed that women are underrepresented in research careers, and to its credit, the OECD now has an Office of Sex and Gender Research. However, across OECD's 36 member countries, women comprise only around 40% of all researchers, and they are considerably less likely to be in leadership positions. So I launched Wham, a nonprofit, nonpartisan organization, to increase the awareness of and accelerate funding for women's health research, because women's health is a societal and economic issue that none of us can afford to ignore. And because while women drive the economy and make the majority of healthcare decisions across the globe, women are still an understudied species and continue to be underrepresented in vital health research. How's that possible? As a business leader, I tend to look at problems with economics in mind, and I believe that change starts with data. And so it became apparent to me that we lacked evidence. We lacked data about the economic costs, benefits, and social impacts of attention to sex and gender in health research. And that the medical research gender gap is a major obstacle to not only achieving equity in healthcare, but to advancing the health and well-being of women around the world. As women globally drive the economy, that gap is holding us all back, which is why we're grateful that IdeaGen is helping us bring this conversation to light.
You know, Carolee, what you just stated is obviously profound for so many levels, so many reasons at so many levels. The data, it's really interesting to hear you talk about the data. It appears to me over the years, having had so many conversations around the economy, the global economy, what makes sense, what doesn't, that data-driven decisions make sense. In this case, it makes incredible sense. It's just good sense, literally and figuratively. And so when you're leading with that, those that may not support this type of an effort have to stand back and say, well, it makes good economic sense as well, in addition to simply making sense. Okay. So I love that you started with the data. It's powerful. And back in 2015, we are aware that the United Nations came together unanimously, very important to note, unanimously, to agree upon these 17 global goals referred to as the global goals or the 17 sustainable development goals, etc. These goals are incredibly powerful for the simple reason that if you just make them a negative, if you turn them around and say, I don't want clean water, or just go down the list, no one on the planet will disagree. We may disagree on how you get there. There are different, ideas and all that. Fine. But we agreed, all 193 member states of the United Nations agreed to these 17 very powerful goals, like no poverty, gender equality, no hunger. How about that? Right? So as we look at these 17 goals, could you please, Carolee, describe your initiatives at Wham relating to the 17 global goals of the United Nations?
Well, first of all, I commend you for all of the work that you're doing to move this forward, because without your attention and without the focus and attention and energy from so many of us, these changes will not happen, as we know. And we're all here to solve some of, I think, the toughest global challenges by 2030 using the guidance of the United Nations Sustainable Development Goals. So Wham's vision and mission directly supports, specifically to, in a very targeted way, of the United Nations Sustainable Development Goals. Goal 3, which is the good health and well-being as defined by the World Health Organization, as ensuring healthy lives and promoting the well-being for all at all ages. Clearly, that's a focus of ours. And goal number 5, gender equality, achieve gender equality and empower all women and girls. Let's face the facts, the pandemic only exacerbated existing inequality for women and girls across every sphere, from health and the economy to security and social protection. So there's no opportunity for gender equality and empowerment without universal health. Let's be honest about this. And that's another reason why Wham exists, and that is to change the conversation to one of social and economic impact. Remember, women drive economies. This is a known fact. All of our data comes from leading academic institutions with whom we partner. And there's virtually no concerted drive to fund research and sex-gender differences across diseases that disproportionately impact women in brain, heart, cancer, and autoimmune, which are the 4 areas that Wham is particularly focused on. And at the same time, there's very little global cooperation among women leaders to change the status quo. And we would like to change that at Wham. For too long, this issue has been overlooked, and the time to address it is now. If the future of healthcare is precision medicine, then sex-based research is the gateway. An approach which is blind to sex differences ignores the basic math of non-communicable diseases that disproportionately impact women in terms of diseases that are related to aging, such as dementias in basic science, as we're different down to a cellular level. Every cell has a sex.
And there you go. And there you outlined it so well. And, it's really all about a hyper focus on these goals to say where it's already outlined, where can we move the needle, and how can we change the world to make it a better place? Everyone wants better health outcomes, right? Everyone wants a better health outcome, not only for themselves, but for their family, their friends, their community. And so these issues are paramount. And so do you see, Carolee, any specific areas of health research where we see greater pockets of inequality?
Well, I think there are a number actually where we see inequalities in disproportionately, and it's pretty scary actually. The reports confirm the Wham report that we created with the Rand Corporation confirmed actually great disparities in funding women's health research, and showed, for example, that just 12% of research dollars are allocated to projects that specifically focus on women. 7% of autoimmune rheumatoid arthritis research, for example, and 4.5% of coronary artery disease. But the fact is that 66% of the people who have Alzheimer's are women. So why would you just allocate 12%? And about 60% of people who have autoimmune disease or rheumatoid arthritis are women. Why would you allocate 7%? And can you imagine, heart disease is the #1 killer of women, and yet only 4.5% of coronary artery disease allocated by NIH is focused on women. So there's something wrong with those numbers just from a business perspective. But here's some good news. The Wam report also shows us powerful information across 3 very different disease areas. And we can see clearly that the issue is not limited to one space. The Wam report makes it very clear that sex and gender research connections are across diseases. This isn't just about women. Everyone benefits. Sex and gender research is the gateway, as I said, to the future of precision medicine. So if we added just $300 million to the NIH budget in those 3 areas, we would actually wind up with an economic impact of $13 billion. How can you ignore that? When you look at these numbers, they're staggering. And so, yes, there are reasons why Wham was created, and that was to at least begin to implement some of these findings. And might I add, George, that we have recently proposed, along with Jan Schakowsky and Tammy Duckworth, resolutions in Congress to double these numbers.
Well, that's fantastic to hear that, there's support even in the US Congress for this based on everything that you're doing and the advocacy and the data and the numbers that you're citing, because it just, again, when something makes sense, it's hard to argue against it unless you can come up with an alternative, sort of perspective. And here at IdeaGen, one of the things that we're so proud of is the notion of furthering cross-sector collaboration. And I know that you're also a proponent of that. You're talking about business, you're talking about healthcare, you're even talking about finance in this discussion, right? So it's not just one sector. And I've always believed, based on speaking with very smart people across the planet, that solutions often lie perhaps one sector over. And some magic happens when you convene and you have someone from finance sitting next to someone from healthcare, and on and on. So we know that. How does Wham specifically collaborate with entities in other sectors? And Carolee, why is this so critical and crucial for your success?
Well, you just hit the nail on the head, George, when you explained that cross-pollination and synthesis of information takes place when you have people from different parts of the ecosystem together. And at Wham, we are incredibly focused on collaboration because in our eyes, all boats rise when women become a priority in health research, because there have been some such disparities that we're trying to get at least those boats to float at the same, like you did, at the same level, at the same water level. And Wham has 3 very specific initiatives that rely heavily on collaboration. The Wam Report, which I mentioned, which is a series of studies that quantifies the economic costs and benefits of increasing investments in women's health research, and in which, as I mentioned, we had collaborated for over a year with the Rand Corporation. So as you pointed out, this is not an emotional discussion, although it is about equality and social justice. It is also about, however, economics. And it is about hard data. And it is, as you pointed out, very hard to challenge the hard data. The second area where we really aim to collaborate is the Investigators Fund, which we created in order to fund women's health research and collaborate with leading institutions around the globe to identify cutting-edge research. And we're in the process of doing that right now. And the Wham Collaborative. And this is very exciting to me because, to your point, I'm not generally used to being with brilliant scientists, but this collaborative and other brilliant business people and people from the ecosystem who are focused on women's health and well-being, which affects the entire planet, we bring together and empower esteemed leaders, researchers, and medical experts in women's health and the study of sex differences from foremost institutions around the globe and across disease areas to work with Wham in accelerating health research focused on women. So that collaborative now has 35 members. And it's extraordinary when we bring all of these brilliant people together because many of them have never met each other. They've heard of each other's work. They heard about each other. But this gives them a chance to collaborate in a neutral territory. I feel a little bit like Switzerland. And Wham Collaborative members work together with us to help us identify and prioritize key questions for women's health research and share their research insights across silos, because you know that everyone is siloed, and generate interest and momentum in the research community to focus more in this area. And then we also partner with leading institutions in the US focused on women's health to develop the unbiased, data-driven reports. And some of those are the Connors Center for Women's Health and Gender Biology at Brigham and Women's Hospital at Harvard, who happens to also be our lead scientific partner. We partner with the American Heart Association, the La Jolla Institute for Immunology, which is a leader in this very important area of study, as we all know, and the Bright Focus Foundation based in DC. So we also recently initiated a Wham data-backed resolution, as I mentioned, and are partnering with members of Congress. And in so doing, we had some extraordinary other organizations, leading health organizations, who joined us to sign on in this measure to double our funding in these areas. And some of those were people like Northwell Health in New York, Icahn School of Medicine at Mount Sinai, McGee Research Institute up in Pittsburgh, and it just goes on. So we wouldn't be able to have those collaborations if it weren't for Wham, and if it weren't for the excitement and energy that bringing together people from all different areas of that ecosystem really creates the kind of spark and energy that will create change.
And of course, you know, Carolee, that I'm in 100% agreement with you. It's so exciting to hear how you are leading, absolutely leading on this critical effort. And if I were to ask you about governmental policy-related changes that you believe need to be in effect or made to tackle the issues that you're forwarding at Wham, what would those be?
Well, the one that we're focused on, as I said right now, because as a really an upstart, we're only a couple of years old. So, you know, I think what we've done in those 2 years is amazing. And honestly, George, I hadn't originally expected to take a leadership role in advocacy and policy. I was more focused, candidly, on understanding the research and understanding as a business person what impact accelerating research could make on women, their companies, and on the economy, their families, and the economy at large. NIH, as you know, is the largest funder of research on the planet, and that is where when we did the report, we went to find a lot of our data. In doing that is where we realized where these great disparities existed. In other words, the incidence, rate of disease, preponderance of disease in women, and yet the discrepancy and the distortion or the lack of funding equal funding based on the incidence of disease or the preponderance of disease. And so that was kind of one of the wake-up calls that said, this doesn't make sense. More dollars, we're not trying to take dollars away from anyone. We're requesting, it's a small amount of money, actually, in the grand scheme of things. If you look at the numbers that are already invested, for example, in heart disease, only $20 million is invested in research on women, specifically focused on women. It's the number one killer of women. 1 out of 3 women will die of heart disease. How is that possible? So when you start looking at the numbers that way, you have to say, how do we make a change? And one of the ways that you can make a change, we had garnered the interest and attraction of a number of Congress people who had come and attended one of our sessions where we were delivering this data, and they were swept away. How can you not be swept away by the data, right? As any individual, I mean, like you said earlier, you have a beautiful wife, you have a couple of daughters, you have a mother, a grandmother. But women, when you hear this data, you have to scratch your head and say, it's not possible, not in my lifetime. So it became immediately apparent that one of the ways that we might be able to make an immediate impact is to say, hey, just take this report, look at the number. If you see what Rand, if you listen to what all their economists said when they crunched all this data, it's an investment of $300 million. It returns $13 billion. I can break this down for you in much more detail, but that's the bottom line. Why wouldn't you do that? And so that's now going to go through Congress. And I think our goal right now is to make sure that that does get to the Appropriations Committee and any place else it needs to get to. So it does get attached to a bill and eventually get passed. That would be an amazing accomplishment for Wham.
And I can't think of anyone else more positioned and more ready to lead this effort than you, Carolee Lee. And as we look at these inequalities and inequities in health research, from your perspective, you've outlined several areas that can move the needle. Any other areas that you see that should be targeted in order to eliminate these inequalities and inequities in health research?
Well, I think that what we did, there are so many areas, as you well know, and what we did at Wham was we identified 4, as I mentioned, autoimmune, cardiovascular, brain health, and cancer, that are interrelated to one another and will undoubtedly affect a woman in her lifetime. And so we tried to focus on those areas of disease that had the greatest economic impact to women, their families, and the economy. Clearly, reproductive and maternal issues we know are a separate issue altogether and enormously important and relevant to the well-being of women and girls. And we did not intentionally start there. We started, as I said, in the 4 areas that I've mentioned. There are so many areas, George, that we will eventually get to and need to focus on. And obviously in brain health, there's mental well-being. And clearly with the impact of COVID, I had the wonderful opportunity to be at the same program and speak at the same program as Dr. Michelle Williams, who's the dean of the Chan School of Public Health at Harvard. And we've been communicating back and forth and trying to figure out how to collaborate. And one of the things that she said to me, which absolutely floored me, is that women have actually been set back due to COVID about 44 years in 18 months. So I think we have our work cut out for us in, for me, staying very focused on what Wham set out to create, which was the Wam Report, the Investigators Fund, and the Collaborative. And if we can make those 3 efforts successful, I think we will have created significant change and impact that it will be hopefully reverberated globally. That's what we're really trying to do.
Well, Carolee, you just stated it so succinctly, and this has been such a powerful interview to hear about your work and the work of Wham in just the short time that this organization has been really leading on these critical health-related matters to advocate for women and girls across really the planet. I can see that you're proud. You have a lot to be proud of. And I know you're just beginning. That's what I'm really excited about. I can sense that you're just beginning. And I think that our global audience, the millions of people that will see this interview on IdeaGen TV and all of our ubiquitous distribution platforms, what is your call to action?
Mm-hmm. Well, first of all, thank you for the kind words and the enthusiasm. I appreciate it, and I look forward to truly to partnering with you to make this happen, because no one can make this successful on their own. And no one knows this, I think, better than I, having led a particularly successful business career and understood the value of collaboration throughout. You've so clearly also identified that this is a critical opportunity for people across the world and across all disciplines and across communities and across industries, for all of us to focus on finding new ways to create real change in the status quo that we have. We can't leave it as it is. It doesn't work. And fortunately, like you said earlier, there is a much greater emphasis not only on women and girls, DEI, but the fact that we're living in a different world. It's a different time. And I would implore everyone to amplify this glaring data and harness the information from the Wam Report, which can be found at the whamreport.org, and to change the conversation in a meaningful and impactful way. It's going to all be up to us. It's much more than gender equality. And that's why I wanted the data. The economic disparities that exist because of the medical research gap clearly have devastating impacts, not only for women, but for their families and our economies. And I don't think we should any longer ignore this. Women drive economies, and we must keep them healthy and well. They also take care of our families. So your viewers can help by supporting Wham and the research it does, by making a contribution to Wham at whamnow.org, by signing up for our newsletter to stay up to date on the progress that Wham is making. And in September, I'm really excited that we're creating a new website that will have crowdfunding opportunities to specifically fund individual research projects. So in September, tune into that because that will give anyone the opportunity, if they're interested in a particular area, whether it's brain cancer, heart, to understand who our researchers are and communicate directly with them. And thank you so much for asking that question, because really it means so much to Wham. And it has been such a pleasure to share Wham with you and all of your guests, and all we can do to create dramatic and sustainable change through collaborating together. I'm on your team.
Carolee Lee, President and Founder, CEO of Wham. Thank you so very much for your inspiration. Thanks for all you've done. And thanks so much for what you will do.
Thank you, George. Looking forward to partnering with you.
Likewise. Thank you, Carolee.